New at 5, Oklahoma health experts weigh in on the Texas governor's decision to reopen his state. The executive order calls for Texas to start reopening March 10th. 2 Works for You's Brady Halbleib joins us live now with how Oklahoma public health experts are responding to the news from our neighbor.
Yeah, Karen, well, it's no surprise that many medical experts oppose this executive order. Many are calling it premature and irresponsible. But based on local data here throughout the state, many are optimistic for the future, specifically this summer.
I'm issuing a new executive order that rescinds most of the earlier executive orders.
The Texas governor's executive order to reopen is causing concern for Oklahoma health officials.
Didn't make a lot of sense from a public health standpoint.
OU Chief Medical Officer Dr. Dale Bratzler says the region is on the mend. Oklahoma's daily average for new cases is down 84% since January, a similar trend being seen in Texas. However, retracting public health measures now could have a rebound effect.
You know, the majority of people in Texas and in Oklahoma have not received the vaccines yet.
COVID-19 variants have not yet impacted our state's trend, but with more people traveling for spring break, the risk of a variant spread is greater.
You could see a new outbreak of COVID-19 from one of the variant strains.
Dallas resident and former OU student Shireen Hashim shares her concern over the new executive order.
It's kind of crazy and premature, to be honest with you.
Meanwhile, others in Texas say now is the time, and it's crucial for kickstarting the economy.
I'm just so glad that we are starting to see the beginning of the end.
I'm excited not to have a mask on.
Hashim says residents were taking safety precautions seriously, but starting March 10th, masks will be optional and businesses can operate at 100%.
The vaccine hasn't even been, offered to the general public yet. So why is he doing this?
A sentiment shared by Dr. Bratzler.
Vaccine is our ticket back to normalcy.
Now, getting back to normal will depend on one thing, and that is immunity, whether that's from the vaccine or from previous infection. Now, coming up tonight at 6 o'clock, we take a look at the immunity of the entire state and how that's impacted our current downward trend. For now, live in Tulsa, Brady Halbleib, 2 Works for You.